This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. We have three guests joining us this morning. We have Dr. John Sunyecz and Dr. Christine Wilson. Good morning, guys.
Good morning.
They are both gynecologists with Mon Health OBGYN Hopwood. We also have Dr. Craig Herring, OBGYN with Mon Health OBGYN Morgantown. Good morning, Dr. Herring.
Good morning.
Gee, I wonder what we might be discussing on today's program. Well, we're going to be talking about the Center of Excellence in Minimally Invasive Gynecology is our focus today. But even with three guests this morning, I have to give each of you just a moment to tell the audience a little bit about yourselves. Eeny, meeny, miny, mo. Dr. Sunyecz, why don't we start with you? Tell us about yourself, a little bit of background, and how you ended up with Mon Health.
Yeah, well, thanks for having me. So I grew up in Northeast Ohio. I went to medical school at Ohio State, and I came over to Pennsylvania and did my residency at McGee Women's Hospital. And then I located in Uniontown and shortly after residency, and I've been here ever since. I've been here for over 20 years, and so been a really nice practice. We decided to join Mon Health back in 2019. It has an excellent reputation. The flagship hospital is 30 minutes away in Morgantown, as you know. And together, the team with Dr. Herring's team, the Mon Health OBGYN team, is nationally recognized and helps care for women at any stage. And in Dr. Wilson and my opinion, it offers our patients optimal gynecologic care within this program and keeps care local in the community.
And Dr. Wilson, kind of the same question, your background, how you ended up with Mon Health.
Well, I am from central Pennsylvania, but came to Morgantown to WVU for undergraduate and medical school. I then went back to central Pennsylvania and did my residency in York. And while there, one of the attending physicians I worked with had come from McGee. So she, when I was looking in this area for a job after residency, she recommended Dr. Sunyecz, and so came out here, joined him, and have been out here for 20 years with him. And so then we were in agreement when, in 2019, when we were looking, and we both agreed Mon Health was the way we wanted to go because it aligned with what we liked, the services we wanted to be able to provide for our patients, but keep care close to home.
All right, Dr. Herring, you've had the cheat sheet. Tell us about yourself, buddy.
All right. I did residency in Charleston, West Virginia, at Charleston Area Medical Center there. And that's where I met my wife, and she's from Morgantown area, so that drew us here. We knew we wanted to be in this town. And then Mon Health's excellent reputation, patient-focused care, just told us that's where we want to be, and we were able to make that happen.
Well, guys, thanks so much for taking some time this morning. Dr. Herring, could you explain to me what are we talking about when we're talking about Mon Health being a center of excellence in minimally invasive gynecology?
Yes. So what is minimally invasive gynecology? It's where we're making small incisions on the abdomen instead of a large C-section type incision to either remove the uterus or the ovaries, tubes, all those female parts that may be causing problems through these small incisions. And we have been, I guess, reviewed by a corporation called Surgical Review Corporation, who's a nonprofit organization, and they set certain standards in minimally invasive gynecology, like What are your infection rates? What are your conversion rate from a minimally invasive surgery to an open procedure? How are your pre-op instructions given? Does the patient understand the surgery that they're having? How do you prep the patient for surgery? Are you giving them antibiotics prior to surgery? And then how's the discharge information for the patient? Do they understand what to do afterwards, when to follow up, when to call if there's a problem? What are our infection rates? So all those, what's our volume like? And so all those things are graded or reviewed by that corporation, and they only select the best of the best, and Mon Health happens to be one of those.
And Dr. Sunyecz, these accreditations are certainly earned and deserved, but patients look at them and goes, okay, so what does that mean for me, the patient? So the question to you is, what does that mean for the patient?
Yeah, exactly. So I'm affiliated with a National Minimally Invasive Gynecologic Society and familiar with standards of excellence of gynecologic care around the country. This group, because of this designation and what it means to achieve that designation, it offers and provides the same high-quality care and procedures found at leading centers really throughout the country. And so to me, that's what it means for our local community. They're getting, I think, the best of the best care, and I can speak to that by knowing what the different academic centers, what the different leading centers around the country offer, and we offer that here right at home, locally to our community and to our patients. And
before we take our first break, Dr. Wilson, this question comes up on this show often. At what age does a woman or should a woman start seeing an OBGYN or gynecologist?
Well, technically speaking, the American College of OBGYN recommends that a girl see a gynecologist for the first time between the ages of 13 and 15. But the majority, I would say, probably don't. Basically, the first pap smear is not done until the age of 21, so there's a lot of women that don't come in until then. But truly, any age they can come in if they're having any problems with their periods in terms of pain or heavy flow or PMS symptoms, things like that. But it really can, the earlier you can start, the more you can educate patients on what's normal and what's not normal so that they can be as healthy as they can be.
Our guests this morning are Dr. John Sunyecz and Dr. Christine Wilson, gynecologist with Mon Health OBGYN Hopwood, and Dr. Craig Herring, OBGYN with Mon Health OBGYN Morgantown. Got to squeeze in a quick break. We're back for more. This is Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests this morning are Dr. John Sunyecz, gynecologist, and Dr. Christine Wilson, also gynecologist, Mon Health OBGYN Hopwood, and Dr. Craig Herring, OBGYN with Mon Health OBGYN Morgantown. Dr. Sunyecz, can you explain what is a minimally invasive procedure and what types are offered at Mon Health Gynecology?
Sure. Yeah, as Dr. Herring had mentioned earlier, really it's any procedure, in my opinion, that's previously required a larger incision and prolonged healing. Over time, with our training, as well as technology has improved, these procedures are done with smaller incisions and generally result in quicker healing and easier recovery. So minimally invasive procedures that we do quite commonly are we can diagnose and treat endometriosis. Patients that have troubles with fibroids can be treated minimally invasive. And patients that have further problems, if they need a hysterectomy, most hysterectomies can be done minimally invasive. And then there are ways of fixing pelvic prolapse. Patients unfortunately suffer dropped bladders and things along those lines. Incontinence can be helped with minimally invasive procedures that have improved significantly over time.
And Dr. Wilson, the advantages to the minimally invasive procedure, Dr. Sunyecz kind of touched on a little bit there. The recovery time dramatically shorter, but I would have to imagine there are several more advantages there.
Yes. Yeah, the main thing for sure that patients see from a real standpoint is how quickly they get back to their life and their activities. But using the minimally invasive approach definitely has been proven to have less bleeding, less pain, less infection, and less scar tissue. And if you have to go back in and you have had a minimally invasive procedure previously, you're much less likely to have scar tissue in your abdomen or pelvis.
And Dr. Herring, how surprised are patients when you tell them that some of these procedures are minimally invasive and recovery time's minimal, and it's not, I would have to think that the procedure is not as daunting once they start to learn about how these complex procedures have become, I don't want to say routine, I'm not getting the procedure done on me. It's routine on somebody else, right? But how they've become so much easier to complete and to recover from.
Correct. The times for surgery have become shorter, and of course, less anesthesia time is better for your healing process. And they also find out that they can go home the same day. Many of them are very surprised by that, but because of these small incisions, and these incisions could be like in the vagina itself or through the vagina itself, that's also minimally invasive, and better, quicker healing, less, like as Dr. Wilson said, less chance for infection. So they're very surprised, and also find that the time that we say, it may take this amount of time to heal, is also very reduced for them compared to in the past.
Dr. Wilson, how common are hysterectomies, and can that procedure be done in the same day?
Hysterectomies are the second most common surgical procedure that women receive after C-section, and roughly somewhere around 300 to 500,000 hysterectomies are done in the United States. The majority of our hysterectomies can be done minimally invasive, and so basically they do get to go home the same day. Some of them go back to work as quickly as 2 weeks, and so it really does. It's a much different hysterectomy than your grandmother's hysterectomy.
Yeah, those probably took several days in the hospital, I would imagine, if we're talking 30, 40 years ago. As recently as
probably 20 years ago,
wow.
When a lot were still being done abdominally. That would be a 2 to 3 day hospital stay and a 6 weeks recovery period where the patient wasn't working.
It's amazing to me. We talk so much week in, week out, whether we're talking heart procedures or orthopedic procedures, how advanced the procedure itself has come and the technology has come in really a short amount of time. And here I am sitting here, you're telling me you can do it in the same day, and it used to be a 2 or 3 day hospital stay. It's amazing to me.
Mm-hmm.
Dr. Herring, I heard endometriosis mentioned earlier. What is that? How do you treat it?
So endometriosis is fairly complex, but try it in simple terms. It's where the lining of the tissue of the uterus gets outside of the uterus. So it may be in the pelvis, it may be on the diaphragm, could be in the lungs, but somewhere else besides where it belongs inside the uterus. And then as the female hormones go monthly and those tissues outside the uterus get stimulated, they can cause scarring, and then that causes pain. So these women often experience increased menstrual pain, much increased over what a normal woman would have. And so that affects their daily life. Oftentimes they're missing work or missing school because of so much cramping that they're having, and that's what we try to help them with.
So how do you treat that?
So basically, we can treat it medically and we can treat it surgically. Medically, we want to try to reduce the amount of hormones that are affecting those tissues outside the body, right? So how would that occur? So you try to reduce the number of periods someone has. That can be done with birth control pills or maybe IUDs or prolonged birth control pills, where instead of every month they're having a period, maybe they have one every 3 months. And then surgery, we try to correct it by actually removing those little implants or burning those little implants out so that patient gets some pain relief from that procedure.
Dr. Sunyecz, I haven't forgot about you. I know you're still hanging out there. Tell us about and explain the patient experience, because we hear it I think we hear it in the open of the show. Mon Health, feel the difference. What does that mean for the patient?
Yeah, and I can tell you that term definitely applies to Mon. That's something that I think Dr. Wilson and I have learned since joining. Feedback from patients about the care they receive from the time really they enter the hospital to the time they are discharged after their procedure, it's phenomenal. I've operated at 5 hospitals over my career and have never experienced the consistent positive feedback that I receive from patients having their procedures at Mon. Certainly over the procedure, regarding the procedure, the high-tech term is certainly used at Mon, but then also the perioperative treatment, it's a high-touch type of feeling. So high-tech, high-touch is certainly, I think, one of the things that you can feel the difference with patients and having their procedures at Mon.
Got less than a minute. Dr. Herring, how can patients reach out and schedule an appointment?
Yes. Let's see. So we can be reached at monhealth.com/OBGYN.
At monhealth.com/OBGYN. Go to the website, and you can get information on, of course, Mon Health OBGYN Morgantown or Mon Health OBGYN Hopwood. Dr. John Sunyecz, gynecologist, Dr. Christine Wilson, gynecologist with Mon Health OBGYN Hopwood, and Dr. Craig Herring, OBGYN with Mon Health OBGYN Morgantown. Guys, thanks so much for taking a few minutes with us this morning here on the show. I appreciate it. You're welcome back anytime, of course.
Thank you for having us.
Thank you very much.